Hi, I'm Dr. Mohammedipur from Mashhad University of Medical Sciences. In this video, I wanna talk about the pharynx. This slide is a sagittal section from head and neck, and here is the pharynx, a muscular membranous tube which extends from the cranial base to the inferior border of the cricoid. Here is the cut surface of the cricoid, a cartilage in the larynx. Okay. At this level, the pharynx becomes continuous with the esophagus. As you know, this tube, the pharynx, is a common pathway for air and food. Right? This tube, as you see, is located in front of the cervical vertebra. But it's important to remember that some structures, including ligaments, muscles, and fasciae, separate the pharynx from the cervical vertebra. These structures are the anterior longitudinal ligament, or ALL, anterior longitudinal ligament. Some cervical tip muscles, in particular longus colli, here is longus colli, here is longus colli, and also some fasciae are between the pharynx and cervical vertebra. The prevertebral fascia, the alar fascia, and the buccopharyngeal fascia. All these mentioned structures are here, right, between the pharynx and vertebral column. In other words, the pharynx is located in front of these structures, and as you see, it's situated behind the nasal cavity, the oral cavity, and the laryngeal cavity. According to its location, the pharynx is subdivided into three parts: the superior, the middle, and the inferior. The superior part, as you see, communicates with the nasal cavity, so it's called the nasopharynx. The middle part communicates with the oral cavity and is called the oropharynx. And the inferior part, which is located behind the larynx and communicates with the laryngeal cavity, is called the laryngopharynx. Here is the laryngopharynx, which, as I said, becomes continuous with the esophagus. Okay. Let's see these parts one by one. First, the nasopharynx. Here is the nasopharynx, the most upper part of the pharynx, which extends from the cranial base to the soft palate. It's bounded above by the inferior surface of the sphenoidal bone, and also by the inferior surface of the basilar or basilar part of the occipital bone. So here is the roof of the nasopharynx. Okay, and on the opposite side we've got the floor of the nasopharynx, which is formed by the upper surface of the soft palate. There are two important foramina within the nasopharynx. Note that, as I said, this slide is a sagittal section. So here we've got only the right half of the nasopharynx, and here we've got only one foramen. Okay, this foramen is the opening of the eustachian tube. Here is the eustachian tube, which connects the nasopharynx to the middle ear or tympanic cavity. Because this tube connects the pharynx to the tympanic cavity, it's also called the pharyngotympanic tube. This tube, as you see, consists of a bony part near the tympanic cavity and a cartilaginous part which is greater and opens into the nasopharynx. Here this foramen is the opening of the tube. Look at here. There is a bulge or a prominence just above the opening. This bulge is formed by the cartilaginous part of the tube. Because of that, it's called torus tubarius. Torus means bulge, prominence, or swelling, and because this torus is formed by the tube, it's called torus tubarius. Here is the torus tubarius. We've got another torus within the nasopharynx. It's here. This torus contains muscular fibers, and we've got the levator veli palatini muscle under the mucosa of this torus. For this reason, it's called the torus levator or torus levatorius. Here is the torus levatorius, which extends onto the upper surface of the soft palate. Here we've got another mucosal fold named salpingopharyngeal fold, which contains the salpingopharyngeus muscle. This fold, as you see, extends from the torus tubarius to the internal surface of the laryngeal wall. In addition, we've got a ridge in the lower part of the nasopharynx. It's here. Can you see? This ridge during swallowing is formed by contraction of the superior constrictor muscle and acts as a sphincter. Because of that, it's called palatopharyngeal sphincter. Why palatopharyngeal? Because it extends from the soft palate to the pharyngeal wall. Note that this sphincter is also called Passevan ridge. Passevan ridge, or you can say also palatopharyngeal sphincter. This ridge or this sphincter during swallowing has a role in closing this pathway or isthmus between the oropharynx and nasopharynx. Okay, let's review the nasopharynx. We said that this foramen is the opening of the eustachian tube or the pharyngotympanic tube. Here is the torus tubarius. Here we've got the torus levatorius. This fold is the salpingopharyngeal fold, and here is the Passevan ridge or the palatopharyngeal sphincter. Okay, here this area, the area behind the salpingopharyngeal fold and also behind and above the torus tubarius is pharyngeal recess. Here is the pharyngeal recess, which contains the pharyngeal tonsil. Here is the pharyngeal tonsil, which is located in the roof and also the posterior wall of the nasopharynx. The pharyngeal tonsil is also called nasopharynx tonsil, also third tonsil, and also is called the adenoid tonsil. The pharyngeal tonsil in some children becomes greater than normal and blocks the space of the nasopharynx and leads to nasal breathing problems. As you know, in addition to pharyngeal tonsil, we've got other tonsils, for example palatine tonsils and also lingual tonsil. It's important to remember that we've got only one pharyngeal tonsil, and here is the right half of the pharyngeal tonsil, but we've got two palatine tonsils, okay, and here is the right palatine tonsil. Uh, in this slide, here is the pharyngeal tonsil, here are the palatine tonsils, right and left, and here is the lingual tonsil. These tonsils form a lymphoidal ring, which is called circumpharyngeal ring, or also is known Waldeyer's ring. Here is the Waldeyer's ring, which is formed by the pharyngeal tonsil, palatine tonsils, and lingual tonsil. Usually, tubal tonsils are also considered as a part of this ring. The tubal tonsil is a small tonsil around the opening of the tube. The pharyngeal tonsil is mainly supplied by these two arteries, the ascending pharyngeal artery and also by the ascending palatine artery. In addition to these arteries, the basisphenoidal artery also has a role in supplying this tonsil. This artery is a branch from the inferior hypophyseal artery and supplies the bed of the tonsil. Okay, the basisphenoidal artery clinically is important because it's a possible cause of post-adenoidectomy hemorrhage in some patients. The mucosal membrane of the nasopharynx is innervated by the maxillary nerve, and here is the nasopharynx, and as you see, it's supplied by the pharyngeal branch of the maxillary nerve. Okay, let's see the oropharynx, the middle part. Here is the oropharynx, which is located between the soft palate and superior margin of the epiglottis. Here is the epiglottis, and here is the oropharynx. The oropharynx contains the palatine tonsils. And here in this slide you can see the right palatine tonsil, and as you see, it's located between two mucosal folds, the anterior and posterior. The anterior fold or arch extends onto the dorsal surface of the tongue or gloss, and is called palatoglossal arch or fold. Here is the palatoglossal arch. The posterior one, which extends from the soft palate to the internal surface of the pharyngeal wall, is called palatopharyngeal arch or palatopharyngeal fold. The membrane, the mucosal membrane of the oropharynx, like the posterior third of the tongue, is supplied by the glossopharyngeal nerve. Let's see the last part, the laryngopharynx. Here is the laryngopharynx, the most inferior part of the pharynx. This part, as I said, becomes continuous with the esophagus and is located behind the larynx. Let's see the pharynx in a coronal section. Here is a coronal section from the pharynx, and you can see the nasopharynx, oropharynx, and laryngopharynx. Here is the nasal cavity, and you can see the nasal septum, right? So this space is the nasopharynx. Here is the oral cavity, and you can see the tongue. And here is the oropharynx. And here is the most inferior part of the pharynx, the laryngopharynx. Look at the laryngopharynx. There is a fossa on either side of the laryngopharynx, and it's called the piriformis. Fossa piriformis. Here is the fossa piriformis. Here is the fossa piriformis. This fossa clinically is important because it's a common site for the lodging of sharp ingested bodies such as fish bones, and anatomically also it is important because we've got an important anastomosis under the mucosa of this fossa. In this slide here is the piriformis fossa without the mucosal membrane, okay, and as you see there is some vessels and nerves. This mentioned anastomosis is formed between the superior laryngeal vessels with the inferior laryngeal vessels, and also by the internal branch of the superior laryngeal nerve with the recurrent laryngeal nerve. And this anastomosis is called ansa galeni. Ansa galeni is an anastomosis between the internal branch of the superior laryngeal nerve with the recurrent laryngeal nerve. Okay. The internal laryngeal branch of the superior laryngeal nerve enters the laryngopharynx by passing through a foramen on the thyrohyoidal membrane. This branch, after entering the laryngopharynx, supplies the mucosal membrane of the laryngopharynx. Thank you so much for watching this